The growing Covid-19 variant JN.1 has taken off this holiday season in several countries, but there isn't anything alarming in India. Co-chair at INSACOG's advisory board, Dr. Saumitra told News18 in an exclusive interaction. Microbiologist Das, who is a professor at the Indian Institute of Science, said that the government needs to jack up the surveillance at the airports and fix the system of Covid-19 testing once again. The JN.1 strain of coronavirus has recently been detected in Kerala. On December 8, this case was detected in an RT-PCR positive sample from Karakulam in Thiruvananthapuram district of Kerala. The 79-year-old woman had mild symptoms of influenza-like illness and has already recovered from COVID. According to the press release issued by the Union Ministry of Health and Family Welfare, there has been an increasing trend of COVID-19 cases from the state of Kerala since the last few weeks. This has been attributed to an increase in several samples from the influenza-like illness cases being referred for testing. The government said that a majority of these cases are clinically mild and recovering on their own at their homes without any treatment. However, India on Sunday reported 335 fresh COVID cases and 5 deaths. 4 people succumbed to COVID-19 in Kerala, whereas 1 person died in Uttar Pradesh. The number of active cases crossed 1700 and went up to 1701 as per the Union Health Ministry data. Saumitra told News18 that there is nothing unusual in COVID cases going up and nothing is alarming. Globally, the cases are mostly driven by the JN.1 variant, which is a sub-lineage of BA2.86 Omicron. Lineage JN.1 was first found in Luxembourg, and as per the latest numbers, it has been spotted in more than 38 countries. As it is Christmas and holiday time, the movement of international travelers goes up as an annual routine. Hence, this is the time when pathogens can also cross borders and screening at airports becomes very important. Das pointed out that we must notice that every new wave comes in the month of December or in winter, starting from the first wave to the Delta wave and then to Omicron. Das said that INSACOG has been monitoring the situation closely, including the prevalence of the JN.1 variants along with other variants. He advised that the government should increase surveillance at airports and put a system of COVID testing in place across India, which has been dismantled by many laboratories. Das advised that we only need to be careful. The surge is small, the numbers are still very much in control. He believes that this situation 2 years ago was different from this situation now. Today, more than 90% of our population is vaccinated. He said that INSACOG has not seen an increase in hospitalization and oxygen or ventilator requirements. According to experts, JN.1 carries an additional spike mutation L455S. This mutation is suspected to have the potential to escape immunity. While this mutation has been known for evading immunity, it is not expected to cause severe illness. However, there is a need to alert people as during the festive or holiday period, the exposure generally goes up. Those who are vulnerable or at risk, such as elderly, must mask up and avoid unnecessary exposure. According to media reports, doctors have been reporting symptoms observed recently in COVID-19 patients, including fever, runny nose, sore throat, headache, and occasionally mild gastrointestinal issues. A doctor quoted in a media report who treated patients infected with the latest strains noted that the majority of patients undergo mild upper respiratory symptoms, usually resolving within 4 to 5 days.